Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. for Monday, January 4th, 2021. We're honored to be here on the territory of the Lekwungen speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, we'll be providing a written briefing with relevant information about COVID-19, the COVID-19 pandemic in British Columbia around 3 o'clock. Wednesday as well, and then Thursday, Dr. Henry and I will be back a briefing here in Victoria in the Press Gallery Theatre. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. So today we are reporting on 4 periods from the end of 2020 to today. So on December 31st to January 1st, we had 565 new cases diagnosed in British Columbia. From January 1st to 2nd, an additional 607 new cases. From January 2nd to 3rd, another 500 new cases. And in the last 24 hours, 539 new people were identified with COVID-19. So that brings our total from last Thursday to 2,211 new cases diagnosed with COVID-19, including 22 who were epidemiologically linked. That brings our total to 54,201 people in British Columbia. Of the new cases, 389 were people who live in Vancouver Coastal Health, 1,301 were people living in the Fraser Health region, 64 people were in Vancouver Island Health, 288 people in Interior Health, 169 in Northern Health. We now have 6,823 active cases across British Columbia, of whom 351 people are in hospital, 76 of whom are in critical care or ICU. Additionally, we have 8,785 people under active public health monitoring, excluding Northern Health, which continues to work on our IT system around that issue. So an additional 45,229 people have recovered from COVID-19. Over the past 5 days, we've had an additional 4 days, we've had an additional 45 people who've died from COVID-19 in British Columbia. And once again, the majority of them are seniors and elders in long-term care, or in some cases in our community. And I know of at least 2 First Nations elders who passed away over the last few days. And that, of course, affects us all. We've had 946 people who've died from COVID-19 in British Columbia in this pandemic. And I know their families, the care providers in our communities are all mourning their loss. And our condolences go out to everybody who's been affected. We have 6 new healthcare outbreaks in the province at the Braddon Private Hospital, Creekside Landing, Kin Village, Madison Care Centre, Royal City Manor, and Williams Lake Seniors Village. An additional 8 outbreaks have been declared over, including Chilliwack Lifestyles, Finnish Manor, which was another one of the more difficult outbreaks that we have had in the province. Holyrood Manor, Northcrest Care Centre, St. Jude's Anglican Home, the Gardens at Qualicum Beach, the Residence at Clayton Heights, and 3 Links Care Centre, another one of those most challenging of our outbreaks, have thankfully been declared over now. That leaves us 52 active outbreaks in long-term care and assisted living and 8 in acute care, involving 1,427 residents and 758 staff. In addition, there's been 1 new community outbreak declared at the Portal Shelter in the Fraser Health region, and the one that we had been managing at Cove Shelter has now been contained and declared over. Today, I'm going to give an update on our immunization program and the vaccination status and what we're how we're managing that in British Columbia. I know I had given some of this information prior to the Christmas break, but we have more details now, and we have additional information, particularly from the National Operations Centre, and some guarantee of when some of our vaccine will be arriving. So a recap of some of the important information about our Rbc Immunization Plan. For the first quarter, so what we're talking about are the doses that we received early in December, but for January, February, and March, all of our Pfizer and Moderna vaccine will be prioritized for administrations to priority populations, and particularly as their first dose for the doses we received in December and into January. We've made that decision based on trying to protect as many people as possible during this highest risk period, and making sure that we are still able to give second doses within a reasonable amount of time. And to do that, we have delayed the second dose to approximately 35 days for most people in this first phase, as we know that now additional vaccines will be coming later on in February and March. And the scheduling of these priority groups will vary a little bit as we deal with additional outbreaks in our communities, in long-term care in particular, and in many communities. So we initially put out some more details of what the thinking was, aligned with the National Advisory Committee on Immunization for quarter two. So that's April, May, June of this year. We are now working through what those details will look like, and we will be presenting near the end of January more details similar to what we're presenting today for additional populations. Our focus right now with the vaccines that we know we have coming in the coming few weeks is on these priority populations, and I'll run through these again in some detail. So from December to February, we aim to immunize approximately 150,000 individuals. And I will make a note that we have received a certain amount of vaccine, or we're guaranteed to receive a certain amount of vaccine for quarter one of 2021. Some of that vaccine, thankfully, came to us early. It doesn't mean that the doses that we received in December are added on to those we're expecting to receive in January, February, and March. It's the same amount that we're expecting to receive in the 3 months. Some of it just came early in December. So our focus for the next month till the end of January, so from the doses we received already to February, is residents and staff of long-term care. And we have said that from the very beginning. Those are the people that we know need our protection most. And that's approximately 70,000 individuals across the province. We also know that people who are living in assisted living are also at higher risk because of the communal living setting for this to be spread very, very quickly. And that's approximately 13,000 individuals. We also want to make sure that those people who are in hospitals right now awaiting placement in a long-term care home are protected so that they can get into those care homes as soon as they're available. And that includes about 2,000 people in awaiting long-term care placement, either in the community or in hospitals. As well, we know that it has been the most challenging for families and those with loved ones in long-term care and assisted living, and we will be ensuring as well that essential visitors are able to access immunization. Our second important goal, of course, is to make sure that our healthcare system is protected and is able to operate and efficiently. And we have seen a number of outbreaks in our acute care facilities. And not only does it affect operations because of people being sick and it being transmitted, but also staff need to be off because they have been exposed. So it is important for us to make sure that we are protecting particularly those people who are on the front line of the COVID response and keeping our health system available for everybody else. And that includes ICU, emergency departments, paramedics who do transports back and forth and work in long-term care and in our hospitals, and key people for the response. And that's approximately 30,000 healthcare workers around the province. In addition, we have an important commitment to remote and isolated First Nations communities that we've seen the devastation that can happen if this virus gets into those communities. As well, we know the access to care is much more challenging, particularly as we're heading into winter months. Once we get into February, with the vaccine that we are expecting to have in January, we are hoping and we're planning to get through that group of people. Once we get into February, we don't yet have guaranteed doses of vaccines, the actual numbers that are going to arrive in February, but we expect that that will be coming up this week, and that we'll have a better idea of exactly how many doses we will have each week through February and March. And it is this system that we're getting into across the country of testing the system, making sure the planning and the logistics is getting into place. And that is coming together. It has been challenging, and as we mentioned when we started this, we are learning. There has been bumps and delays, and we'll talk a little bit about some of those in a minute. But after we finish this first high risk and high priority groups, we'll be moving into priority populations that are also the same ones we were talking about for the following 2 months of Q1. And that's about 400,000 people will get their dose 1, given the way that we have set up our schedule. That includes community-based seniors over the age of 80. And for Indigenous people, we've lowered that age group, recognizing the higher risk of having some more severe illness in that age group. People experiencing homelessness and using shelters, and as we've mentioned as well, we've had a number of outbreaks, particularly the downtown east side. We've had a couple of shelter outbreaks in Fraser Health, and again, people who are in using shelters, who are in those situations, are much more likely to end up in hospital. As well, we have a responsibility for other communal living where we know people are at risk, and that includes our correctional facilities, group homes, and mental health residential care. We are also looking at how we can identify people who have home care and home support, and making sure both recipients and staff who work in those sectors are immunized as a priority, and additional both hospital staff and community healthcare workers, including GPs and specialists and others. As well, we are continuing our work with First Nations communities to identify the at-risk communities across BC. So that is our plan for what we know right now for the first quarter of 2021. Once we get through that, we know, at least from the contracts that we know are the health that Canada has in place with both Pfizer and with Moderna, as well as additional seven in total additional contracts with the other vaccine manufacturers. What we have been told is that the contracts for Pfizer and Moderna will scale up come March. So we are expecting to have way more of those vaccines once we get into April, May. We also expect approval in Canada of additional vaccines, and we've heard that the AstraZeneca vaccine has been approved for use in the UK. We know that Health Canada has received at least some of the data and has started the expedited review process, both for AstraZeneca and Janssen. We don't know the exact timelines, but we're hopeful that those will be approved for use in Canada sometime in the first quarter of this year as well. However, the thing that we also know is the contracts, particularly for these vaccines, don't come into play until Q2 in Canada. So we may not receive the Janssen & Janssen or the AstraZeneca vaccine until April, depending on the contracts and depending on production worldwide. So there's a lot of unknowns still about those vaccines, although we are, of course, hopeful that the AstraZeneca vaccine, as we know, is very effective, and it can be transported at fridge temperatures, which makes it much easier for us to use. So contingent on supply, our plan is to begin our mass vaccination strategy based on age and then descending in 5-year cohorts after our 80-plus priority population is completed. And we are working on how do we do that to make sure that it's accessible and fair for people around the province. And we will be detailing that later on this month. So to go back, the estimated number of doses from December to March that we are expecting, both of Moderna and Pfizer, is about 792,000 doses. And our plan is to provide at least 549,000, 550,000 people their first dose, and some of those people will also receive their second dose. So that's approximately 542,000 doses of Pfizer and 250,000 doses of the Moderna vaccine. So we, as I mentioned, we're still working. Now we're about 3 weeks ahead of time. We were in a just-in-time loop, but it's settling out across the country, and we have a better idea a little bit further down the line of how much vaccine we're going to receive each week. So as of January 4th, as of today, we have received 54,625 doses of vaccine in the province. Of that, 34,125 doses were of the Pfizer vaccine. Our very first week, we received it 3,900 doses, so a very small amount, as you recall, in both one place in Fraser, one place in Vancouver Coastal, as a way to test and proof the system. The week of December 21st, we received an additional 22,425 doses of the Pfizer vaccine, and it was distributed to all health authorities and was around the province. It came at various days through the week of December 21st, so it didn't all arrive on Monday. It arrived between the Tuesday and Thursday around the province, and last week, December 28th, we received additional 7,800 doses, all in Fraser Health. The Moderna vaccine, which we're very excited to received approval and notice of compliance on in late December, December 23rd. We received one shipment of 20,500 doses, and it arrived, most of it arrived actually on December 31st. It was to arrive the week of December 28th, and we did receive some on the 28th and through to the 31st. And again, it was received in all health authorities, and the First Nations Health Authority as well received some as per our agreement, working together to provide vaccine to high-risk, remote and isolated communities. So we expect to receive an additional 16,575 doses of the Pfizer vaccine this week, January 4th, the week of January 4th. We've not yet received it. We have just received the packing label, so we expect it to arrive within the following 2 to 3 days, depending on where it's going in the province. I will note that the next shipment of our Moderna vaccine is not expected until the 3rd week of January, although it is varying a little bit. So the Moderna vaccine in Q1 will be coming at 2 to 3 week intervals, where the Pfizer vaccine, we're now in a place of receiving it weekly. So as we've talked about a little bit over the last few days, there's been a lot of planning and preparation that's required for these vaccines. They are not our usual fridge-stable vaccines that we're used to handling. They are very delicate, and both the Pfizer and the Moderna in particular are very delicate in how they're made, and they need to be handled very cautiously, most of it while frozen. So we have done a lot of work preparing for the logistics, whether it's security, handover, temperature controls. The temperature controls are read for every single box in every package centrally through Pfizer, and we need to have approval before it can be taken out of the shippers, etc. There's a lot of things that we're not used to having to do when we're handling vaccines, including ultra-low temperature gloves, being able to work with liquid nitrogen, the thermal containers, which are quite heavy, and how do you get them from one place to another. As well, we've been planning and preparing for the redistribution logistics. So taking the vaccine that's frozen in the, we call them the pizza boxes, and being able to move them to other places. Again, the permission to do that from the company was only received the week before Christmas on the 21st or 22nd, and the shippers, that they have the special containers that you need to keep them in to move them to other places, were coming online as well. As well, we need to plan and coordinate the immunization clinics, making sure that immunizers understand the products, how they're reconstituted, how much is in a dose, what the side effects are, the details that we need to do as clinicians to make sure we can safely provide vaccine to people and know how to deal with the adverse effects should some of them happen. And we know, of course, about things like having allergic reactions to vaccines, which can happen at clinics and which we need to be prepared for. Additionally, we needed to ensure we have a system in place that records everybody's immunization, so we know exactly what lot of which vaccine they received. One, so that we can monitor for safety, which we do very carefully, and also so that we make sure people get the right vaccine for their second dose. So I'm not going to go through all of this, but it's here for you about the Pfizer distribution and logistics, which we say are quite fussy. They have limits on how it can be moved and what size, how many doses you can move and redistribute at any point in time. And then how long they can be kept once they're out of the freezer and thawed. So up until today, the Pfizer vaccine has been allocated in British Columbia in the following. So Fraser Health has the majority as the largest population, 16,575 doses, 1,950 to Interior Island and Northern Health, and 11,070 doses have gone to Vancouver Coastal Health. So up into the end of today, including the estimates for today, we are expecting that 25,744 of the 34,000 doses will have been delivered to the priority populations across the province. For the Moderna vaccine, as I mentioned, it has fewer limitations on mobility in that it can be transported at -20. We have a few more of those freezers around in the province, and it can be broken down into as small as 100 units. So we received, as I mentioned, one delivery of the vaccine of 20,500 doses. It's gone in small amounts to each health authority and with specific targeted amounts to the First Nations Health Authority around some of the remote and isolated communities. So this has allowed us to redistribute this vaccine not only to those remote communities where the need is great, but also to long-term care and assisted living sites directly, and makes it much easier for us to provide vaccination, particularly in some of our smaller communities, to residents of long-term care. And there's a mixture in places like Vancouver and Fraser Health, where they have the capacity to transport the Pfizer vaccine in the urban area in the higher amounts. So a lot of it has been figuring out how much needs to go where in the last little while. And to date, there's been distribution to many rural and remote First Nations communities, prioritized based on risk and need and the numbers of seniors and elders in the communities. And our First Nations Health Authority has been working with all of us very closely on this, and the nursing station and community clinics will be delivering these doses through this week. So that is very exciting news. We saw some wonderful pictures of elders receiving their vaccines in some places of the province just this past weekend. So that's good news. Up until including today, about 1,600 doses of Moderna will have been administered in BC. As I mentioned, really the majority of it arrived on December 31st, so it has been a slower rollout than we were hoping, but we will be using up the additional doses over the coming week. So up until close of clinics yesterday, we had vaccinated 24,139 people, and 22 of that, 690 was from the Pfizer, and about 1,449 people received the Moderna vaccine. So if we look at where did this vaccine go, about 20% of it made it to residents of long-term care, and that's in the limited time that we've been able to get it out actually to residents. Just under half has gone to staff of long-term care, and that's where we started, recognizing that staff could come to the vaccine centers where we had the Pfizer vaccine. We have a small percentage for staff and residents of assisted living, and another third approximately for healthcare workers in the various settings that we've talked about. So for our next 2 weeks, in particular to January 18th, we are planning on we will deliver the remaining doses from December and January, and the about 16,575 additional doses we have arriving this week. And the focus, as I've mentioned, will continue to be on long-term care and assisted living, making sure that we are protecting those who are most vulnerable in our communities, and then coverage of our front lines of acute care and ongoing immunization in our at-risk First Nations communities. So that is where we are with immunization. It's a monumental task, and there are many months left to go in this. We are constrained by logistics and also by how much vaccine we're receiving, but we're optimistic, and we are focused intensely on making sure we protect people in long-term care and assisted living as quickly as we possibly can, and of course protect those most at risk in our communities. So today, again, many people are getting back to work and back to school after our winter break, which means reminding ourselves about how important it is that we continue to use our layers of protection wherever we may be. And I want to remind people that our orders are still in place, and we will be looking at what we need to do to get us through this next few months as we're ramping up our immunization program and able to protect more people in our community. But first, I want to thank and commend many, many people, the most of us in British Columbia, who put their usual holiday traditions and celebrations aside and followed public health orders to help protect our families, our communities, and each other from COVID-19. Since the start of this pandemic, many sacrifices have been made, both small ones on a day-to-day basis and many big ones, including and up to the very last day of last year. Despite these efforts, we know some people chose to bend the rules, and we continue to have transmission in our communities. And because we know there's a delay between when those exposures happen and when people become sick, we know that we can start to see increased numbers of cases. We've talked as well about people not being tested as frequently during this past period, this holiday period. As a result, right now, I'm asking everybody to be extra vigilant. If you are feeling unwell at all, if you went out for that party or that group meeting or that gathering with family members and you're not sure, please stay home. Stay away from others. And if you have concerns, call 811, take the symptom checker, or get tested. Our testing facilities are open and available and ready for anybody who has concerns, who may have been exposed, who has any symptoms. I also ask you, though, to pay close attention to those symptoms of COVID-19. We know that this UK variant has been found in one person here in British Columbia, and we are looking to make sure that it's not in many more. But it reminds us of how easily this virus can spread. If you develop a cough, loss of sense of smell or taste, fever or chills, difficulty breathing, if you've been at those parties or heard of others who you are close to who are ill, get tested, stay away from others. It is more critical than ever right now that we are all cautious. Our hope is that that leveling off that we saw before the holidays will continue, that enough of us did follow the rules and make sure that we're not transmitting this virus, that we will start to see the numbers coming down again as our immunizations are ramping up. The actions each of us takes today will make a difference for all of us tomorrow and the next week. I want you to know that by choosing to use your layers of protection and following restrictions and orders in place, you are saving lives. We're in this race right now. We need to make sure that we can win. We are 4 days into the new year, and I'm sure many people have set New Year's resolution. What we know about resolutions is that by doing a little bit every day, it turns something new into a habit. And once you have that habit, it can become your success. We already know and have our COVID-19 protection habits. We've been doing it for a while now. So doing your part to protect those around you and yourself isn't new. But we all must keep going now. We know what can happen if we let down our guard. I encourage you, everyone, keep it up, keep it going. Let's make this year our year of success, overcoming COVID-19. We will get through this storm by working together and by remembering to be kind, to be calm, and to stay safe.
Thank you very much, Dr. Henry. I wanted to start on behalf of the Premier and the government, I think on behalf of people in BC, to pass on our condolences to the 45 families who lost loved ones over the past 4 days from COVID-19. This was a period, including the day from December 31st to January 1st, of where we usually welcome the coming of a new year. And for those families, it was the most difficult of times. We're thinking of them today. I want to pass on our condolences, our best wishes, our thoughts to the families, the friends, the caregivers, the communities who lost loved ones this weekend. 28 people passed away in the Fraser Health Authority, 9 in Vancouver Coastal Health, 4 in Interior Health, 3 in Northern Health, and 1 on Vancouver Island. And we're thinking of them, all of them, today. In our acute care hospitals continue to be, of course, as you'd expect, very busy. Yesterday, the day ending January 3rd, we received there were 5,096 emergency room visits, which is a significant number, although less than the average in the pre-COVID-19 pandemic period, which was over 6,000. In our acute care hospitals, currently our occupancy is at about 86.6% of base beds. That leaves 1,251 base beds available, effectively empty. And when you add the surge beds, our level of occupancy is 68.2%, leaving 3,864 beds available. In critical care, our occupancy level is 73.6%, leaving 138 base critical care beds available. And our when you count surge critical care beds, where our occupancy rate is at 50.3%, which leaves 381 beds available. Nonetheless, it's obviously with 351 people in hospital with COVID-19, an extremely challenging time for everyone who works in acute care, especially since they are also doing all the regular and remarkable work they do every day to keep people healthy and help bring people back to health. I wanted to also acknowledge the extraordinary work of our public health teams. As Dr. Henry has said, we had 6,823 active COVID-19 cases in BC, 8,785 people under public health surveillance and isolation, not counting the Northern Health Authority. In addition to that, the significant testing going on and what Dr. Henry has detailed, which is the important and remarkable work being done all over British Columbia in terms of immunization, vaccination to protect people from COVID-19. I note, for example, the 17 Indigenous First Nations communities that have received the Moderna vaccine in the last few days. On Monday, we usually report on PPE. As you'll know, since March through to December 29th, just over the following PPE arrived in BC, just over 8,095,000 or equivalent respirators, 140 million surgical or procedure masks, 3 million pieces of eye protection, 324 million pairs of gloves, and 18,600,000 gowns. Over the last week, the following PPE has arrived in BC: 3,060,110 surgical or procedure masks, 2,329,000 pairs of gloves, 208,406 gowns. We'll continue to source and test to ensure that PPE meets the standard of requirements in our healthcare system. So finally, of course, this is our first briefing at the beginning of 2021. And we have two sets of things that are, one is very positive and one is very challenging. Very positive is the work that's being done on immunization across British Columbia in large communities, in every health authority, and in small communities as well. And that gives us some room for optimism. But it's also a challenging time. We've just come through the Christmas period, and this is the time when everybody has to dig in and remember the guidance and advice of public health and to follow it now. It is absolutely necessary that we continue to do this, that we reduce the levels of transmission in our community, that we hold the line as we have been now, but more than hold the line, to reduce transmission. And that requires all of us to be all in all of the time. That means, of course, washing our hands. That means staying apart. That means not going to work sick, all those critical things that we've talked about. And we have to do it this month. We have to do it now. We know and appreciate, and many, many people have told me the sacrifices they made over the Christmas period. Not only individuals and the way that we celebrate and acknowledge Christmas, not only people who didn't do things in terms of their faith, go to services in terms of their faith that they would ordinarily go to, but many businesses made extraordinary sacrifices as well, not including those in all elements of the business community, including restaurants and bars. We understand the sacrifices have been made, but we need to dig in now. This is a critical time, a time when we are attempting and moving quickly to immunize people in long-term care. This is the time now when we have to reduce transmission in the community. So I want to ask everybody listening here, everyone in British Columbia, to consider the importance of this moment in January 2021. Dig in and to be 100% all in our efforts to reduce transmission of COVID-19. It is so very important now. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 4 périodes de référence de 24 heures chacune, soit celle des 31 décembre et 1er janvier, celle du 1er janvier et 2 janvier, celle du 2 et 3 janvier et celle du 3 jusqu'au 4 janvier. Il y a eu 45 nouveaux décès liés au COVID-19 durant ces périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 946 personnes décédées du COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pendant la première période de référence, nous avons eu 565 nouveaux cas. Pour la deuxième période de référence, nous avons eu 607 nouveaux cas. Pour la troisième période de référence, nous avons eu 500 nouveaux cas. Au cours des dernières 24 heures, 539 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 351 personnes sont actuellement hospitalisées, dont 76 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up only. I would also ask that you please take your phones off mute. You're not audible until I call your name. First question today is from Shannon Patterson, CTV.
Oh, Hi, Dr. Henry. There were 47 cases in 5 classes at a Surrey high school before the Christmas break, and the superintendent said they were linked to PE class, specifically the school gym and the weight room. Is it a good idea to have students, many of them unmasked, exerting themselves and exercising in an indoor space like a school gym? Doesn't this huge number of cases at Earl Marriott suggest we shouldn't be having PE classes right now, especially without a mask requirement?
Yeah, so I think what you bring up are a number of different things. One is what procedures were being followed in that class, in that school, whether all PE classes need to be modified, how they can be done safely. We know that it's really important, and that for some children, the physical aspect of school is important in terms of their learning. So there are ways it can be done safely. The fact that it's happened in one place means that we need to relook at how it is done and can be done safely. And you talk about masks. Masks are an important part of the safety procedures in schools, in all schools. However, we know that when you're exercising and physical exercise, when they get moist, they're not as effective. So I don't think that's the answer to PE classes, but I do think there are things that need to be put in place to make sure that if PE classes are being offered, they're offered safely.
Shannon, follow up?
Yeah, staying with the school theme, concerns are being raised that the latest modeling data only shows schools that have had exposures versus the number of exposure events. Some believe this minimizes the amount of transmission that's actually happening. So why is this the approach that's being taken? And are there discussions to provide more data on school exposures in the future?
Yes, obviously looking at additional data. I'm not sure I quite understand. So we do not all exposure events. All exposure events are reported. They're not, most of them are not linked to transmission. But yeah, we're looking at that. Of course, we want to make sure, and our attempt at the very beginning was to be as open as possible, and that's why all exposure events were reported. As people have noted many times, it's a challenge because we often don't know about them until several days later, and sometimes parents, others are speculating, or they put out information that may not yet be known to the rest of the school community. So there's that challenge in understanding what information is being put out. So that is part of the work that the school response team that I've talked about a few times, Dr. Reka Gustafson, my Deputy Provincial Health Officer and the head of the BC CDC, I tasked her with taking that on along with Ministry of Education, BC CDC, the school health officers from the health authorities, and others, to make sure that we are looking at all of the safety plans. We're looking at those events and what can happen. And one of the things they absolutely are looking at is, what is the data that we have and what can we provide to people to meet those needs. And I will say it's a challenge because we don't collect some information that some people will like, and we can't share some information that some people would like.
Next question is from Marcella Bernardo, News 1130.
Happy New Year, Dr. Henry and Minister Dix. Again, I'm going to be keeping on with the school theme and airborne transmission, especially now in care homes and schools, which may have poor ventilation systems. The World Health Organization and the Public Health Agency of Canada have recognized that this can be spread by aerosols. So why, again, not make masks mandatory in schools?
Yeah, so I think those are not necessarily connected in the right way, Marcella. And we have also obviously recognized that there's a continuum, and I've said this many, many times, maybe not in the last few months, or in the last few weeks, but we've said this, there's a continuum of droplets, and they spread in many different ways. But how you get infected with this is inhaling droplets that contain live virus, enough virus that can infect you. And that's the vast majority of how people are infected. So we know that in some situations, it's more likely for those small droplets that have live virus in them to hang in the environment for longer or to be more risky. And those are the things that we have been talking about repeatedly. Closed environments with poor ventilation, when we're in close contact with people, speaking face-to-face, particularly if we're singing or talking loudly, where we have crowds of people, large numbers of people who are in close contact together. That's how we get super spreader events. So that the measures that we have in place in long-term care, the measures we have in place in schools, are to have layers of protection. So we're reducing the numbers of people, we're keeping distances. It doesn't necessarily need to be 2 meters, depending on what you're doing. It may need to be longer or wider than 2 meters. We've seen this with things like some of the high-intensity gym classes where we know that you need to have more space between people, or we need physical barriers and we need ventilation. And I know there was another paper put out recently talking about the importance of ventilation, which is something we absolutely agree with, and that we've been working with the Ministry of Education to use some of the money that the federal government has had to put into looking at ventilation in schools. But that's only one of the pieces. And the challenge that we run into is there's no one thing that is going to make the difference. It's having all of those pieces in place in the right place. And then sticking with it. And that's been our challenge. We all know that we get complacent over time, or we forget, or we bend the rules a little bit. And that's what our focus needs to be, is staying with it.
Marcella, do you have a follow-up?
I do, and it's in keeping with what you've just said. What can you tell us about the situation at Little Mountain Place, where at least 38 people have died since an outbreak there was declared on November 22nd, and no one seems to be willing to talk about it. And it's very frustrating for many of us, where some health regions are being much more forthcoming with information about deaths. And this is a place where 38 people have died. It is the largest death toll since this pandemic has started, and no one is telling us why this happened.
Yeah, so I do know that it has been a very challenging outbreak. It's one of the ones that we know have been incredibly lethal, and one of the reasons why we have so many measures in place in long-term care, and why we're focusing our vaccination on long-term care. There's no one simple thing as well about why it spreads so rapidly in some places versus others. I know Vancouver Coastal has been on site and daily and bringing in staff to support people in Little Mountain, and that it has been very challenging for them. I understand, and Vancouver Coastal and the care home are providing regular updates to family on an ongoing basis about cases, and yes, tragically, the deaths that we've seen in that care home.
Next question is from Richard Zussman, Global News.
I would also like to ask about Little Mountain and a change in policy from the province. Dr. Henry, why does the province no longer release data on case and death counts at individual long-term care facilities when it used to be provided daily? And at what point, I think the estimate is about 82% of the residents at Little Mountain have contracted COVID. At what point does the province step in to provide additional supports to that residence? You know, in Quebec and Ontario, in some cases, we saw the military step in to help in long-term care. At what point does that happen at a residence here?
Yeah, so in terms of the data, there's been no change in policy. And I have to admit this was taking me a bit by surprise, but we looked into it. Yes, we were receiving early on, when we had smaller numbers, receiving daily updates on the long-term care outbreaks. But as the numbers increase, the actual person power to get that information every day and collate it was taking hours and hours and hours of epidemiology time, because we do not have an IT system that allows us to do that efficiently. So we went to aggregate numbers, which we report on every day, and we went to still reporting the outbreaks, and then the aggregate numbers, and then on a periodic basis getting the more detailed numbers. So it's not a policy change. It was merely trying to keep up with the amount of data that we were trying to collect. And we are certainly willing to provide the aggregate numbers as we get them. And I do try and present that information in our statements and on our daily briefings. In terms of when we would call in the Army, we from the very beginning have had a very aggressive plan to support outbreak response in long-term care homes. And we do it by having teams with public health leadership, with administrative leadership, because that is often a really important part of organizing to manage an outbreak, making sure that we do testing. And this is one of the places we use our rapid tests. As soon as a person in a long-term care home is ill, the rapid tests help us identify right away whether it's influenza or COVID, and we do testing of everybody in the facility, both residents and staff, depending on movement of staff. It may be the whole staff or maybe just people in a certain unit, but we use the rapid test, for example, to do that on an ongoing basis during the pandemic, during an outbreak. As well, we test everybody, whether they're symptomatic or asymptomatic. And we also have been training staff to come in to support long-term care homes. Because as you say, when large numbers of residents are affected and staff are affected, that can mean staffing shortages. So we have not had to rely on staff from the military or other places, because we have a pool of people who are part of the teams that go into the long-term care homes when we have outbreaks. And that has worked so far. And some outbreaks have been very, very challenging. And, two of them that we're finally over today, Finnish House and Three Links, were also ones that were incredibly challenging. We know Jubilee in the north and Invermere in the interior. We don't always know the reason why it seems to spread so quickly in some facilities versus others. We try very much to make sure the staffing is maintained, that personal protective equipment is there, and we did that very early for all of our care homes, that the cleaning processes are in place. We have infection control teams that work with the homes, and sometimes it's just an incredible challenge, and I wish we knew the answers to how it was being transmitted in some cases.
Richard, do you have a follow-up?
Oh, I've just done some quick math, or a colleague actually did the math to give him credit, around the vaccinations. And right now, the average to get through the 400,000 doses by the end of March, you'll have to do about 4,300 people a day. Right now, we're doing closer to 3,000 a day. So are there enough people in the province to vaccinate, register, track the vaccine in order to hit that goal by the end of March?
Absolutely, and I expect that today, think about it, we've only been receiving the vaccine in small amounts over the last 2.5 weeks, and we've got up to that. And yes, we absolutely will be hitting that mark over this next couple of weeks, if not today. And the other thing that we need to remember, of course, is that it's very challenging when we're talking about small communities. So you may take days to get into a community and to immunize hundreds of people, but that protects that entire community. So it's rough numbers. I will say as well that if we're looking at getting to the point of herd immunity, which is something that we are looking forward to in this province, that we're going to have to scale up even more than that once vaccine becomes available. So yes, we're scaling up to meet the vaccine that we have now, and then we need to expand from there as soon as we have more vaccine available that's able to be transported. And we're looking to our colleagues in primary care, the pharmacists who work with us, immunizers around the province, and we talked about some of the nurses and others who were hired as contact tracers. Many of them, if we can control our pandemic, we can reposition people to work on the immunization programs as well. So yes, we are looking at all kinds of how we can expand our immunizing pool in the coming weeks.
Just to say, Richard, that I think our staff has actually done a really good job. If you look at the end of day today, we expect 25,744 first doses of Pfizer to have been delivered. And we're just starting. As you know, the first week we only received 3,900, so that week, by definition, we would have done less than 1,000 a day. In the second week, I think we were around 8,000 approximately, and now we're just ending really the third week of immunization, and we'll do close to double that, or 14 or 15,000 doses. So we're building up every week, and I don't think there's any real concern in terms of this, of course, extraordinarily challenging and difficult task, especially when you look at the distribution to communities big and small around the province that's already taken place. But I don't think there's an issue in this period. We'll also be presenting information as we go along when we go into a more general immunization later on, and that will require, of course, much greater capacity, and we'll have more to present on that in the coming weeks. But right now, this is the amount of vaccine we're receiving, a further 16,000 doses of Pfizer sometime later this week, in addition to what we have on hand now. And I think we're in strong position to deal with all of this.
We have time for one more question. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Tanya Fletcher, CBC.
Thank you. You both kind of went into a bit more detail there, but a lot of people are wondering why fewer than half of the doses we've received have actually been administered today. Dr. Henry, you talked about the logistical challenges. Is that just getting these doses to small communities? And can you elaborate on that at all? And at what point or when do we expect to kind of be running at full steam ahead without trying to catch up on any of those bottlenecks or delays with the supply?
Yeah, so, I talked about some of the logistic challenges, particularly for the Pfizer vaccine, which is the one that we have the most of. It can only be broken down into trays of 975 doses, and so that makes it a challenge to move. And then when you break it down from there and reconstitute it, it can only be kept out for 6 hours. So there is a period of time where before you reconstitute it, you can thaw it in the fridge and transport it. But again, that's a matter of days. So you have to plan things out ahead of time of how to get things to different places in the right amounts so that you're not wasting vaccine and that we don't spoil it or destroy it. So it's a little bit easier with the Moderna vaccine, but as I mentioned, we just received the Moderna vaccine late last week. So yes, I absolutely, as we get more comfortable with how the transportation works, as we get the shippers in, that we're able to use the portable freezers, and as we have our plans a little bit more put in place about how to actually physically get doses from one place to another place within the allotted time frame, within the safety parameters for the freezers, and people to receive them on the other end and ready to immunize. So it's complex at the front end, but once we get that into place, I expect it to go an awful lot more smoothly. We're all learning. We knew there would be bumps. We've been learning across the country about how people are doing different things, and I think it's going to be it's going to smooth out and get ramp up to where we need to be for Pfizer and Moderna for the next few months. And then our major challenge is going to be getting as much vaccine as we receive out to as many people as possible once we hit, my optimistic self hopes it's before April, but at least by April we should have way more vaccines that we can distribute in much more traditional ways to people.
Tanya, do you have a follow-up?
Yes, please, and I'll warn Minister Dix in advance if we could get an answer in French as well. Going back to long-term care homes, and specifically Little Mountain Place, it has refused to answer any questions. They passed our request back to Vancouver Coastal Health, who in turn has told families to go back to the care home for answers. So who's ultimately accountable for their response? Will these outbreaks be investigated? And why hasn't staff capacity been increased so that staff can be properly cohorted to work on only one floor?
Okay, so some of those details I can tell you staffing has been increased, and they've been, Vancouver Coastal staff have supplemented when there have been staff off. And so that may be why people are seeing new faces in some places, for example. cohorting depends on where we're seeing the virus and how it's spreading. So that is something that's an operational piece that the team on the ground will determine as they manage the outbreak. So it varies from time to time. And sorry, the ultimate responsibility absolutely is with the care home, but it's a partnership with us in public health. And the teams in Vancouver Coastal work with the care home. The ultimate authority in terms of directing what happens in the outbreak response is the medical health officer from Vancouver Coastal, in this case, who has the ability to direct the outbreak response. And yes, I don't know the details of why. My understanding is that there is regular information going from Vancouver Coastal to families, and that they are kept up to date on a regular basis about what's happening in that care home.
Oui, premièrement, il y a la responsabilité, bien entendu, du centre de soins, mais aussi de la régie de santé en question, dans ce cas, à Vancouver Coastal Health. Que les familles, d'une manière régulière, ça c'est notre expectation, et bien entendu, des réunions hebdomadaires qui se déroulent avec le soutien de la Medical Health Office de la Régie de santé de Vancouver Coastal Health. Ces réunions se déroulent chaque semaine, donc il y a tout cet effort-là de communication. S'il y a des questions sur la communication pour les régies de santé, je vais bien entendu m'en occuper, parce que ça c'est très important pour tout le monde d'assurer cela. Je pense que quand il y a la déclaration d'un problème dans un centre de soins, il y a toute une participation de la régie de santé. De temps en temps, la régie de santé prend le contrôle d'un centre de soins. Cela s'est déroulé dans plusieurs cas. Mais on travaille ensemble pour répondre aux questions très difficiles. Et on en a plusieurs. Aujourd'hui, la crise a été terminée en quelque sorte à Three Links, Finnish Manor. Mais ces centres de soins ont vu des difficultés extrêmes pendant cette période. Et pour nous, je pense que pour des gens qui y travaillent, des gens qui soutiennent cet effort dans les régies de santé, ceci, c'est une période très douloureuse et sérieuse. I would say, just in English finally, that if there are communication issue, I'll be clearly looking at that. We'll look at that together to make sure that families always have the information they need, and we'll obviously have that discussion with health authorities. I would say that health authorities, with respect to care homes from the beginning of this, have faced extraordinary challenges when we've worked together really on a team basis. And so while the responsibility for what happens in the care home is the responsibility of the care home, there's a significant responsibility of the medical health officer to support infection control, to support staffing, and all of those things happen. And if there are communications issues, of course, Dr. Henry and I will get into those to make sure that people have access to the information they need, in particular the families in question. The challenges of long-term care are something in this pandemic that are, I think, the most painful for everyone involved, the absolute most painful. In British Columbia, in comparison to the other jurisdictions that have had significant pandemic of COVID-19, Quebec and Ontario and Alberta and Manitoba, for example, we've done better, but that's frankly cold comfort to families in situations like Little Mountain, situations such as Three Links and Finnish Manor where there have been significant outbreaks. And in all of these cases, just as there were at the beginning at Lynn Valley and at Harold Park and at Royal Arch Masonic and at Holy Family and other care homes that had significant outbreaks, these are extraordinarily difficult things to deal with. And what it says to us is that we've got to continue to take all of the measures that we're taking that Dr. Henry has described today, the single site orders, all of the efforts done to increase and support staffing in long-term care. We've got to do all of that. And then all of us have to as well do everything we can to reduce community spread of COVID-19. As we know, on Vancouver Island, there have been, I believe, no fatalities in long-term care. Well, that's a large measure because we've had less community spread. So we all have to work together. We're all part of this effort, and we all have to continue to do that work, particularly right now as we are immunizing people in long-term care, as people are receiving the vaccine, staff and residents in long-term care. We have to dig in now. All of us have to dig in now to do everything we can in every moment of every day to stop the spread of COVID-19, and I'd ask everyone to join in that effort, thinking of all that people have struggled with and suffered and dealt with in long-term care. Thank you very much. We'll see you on Thursday.